Thanks everyone for joining today's session. I'm Anne Livingston on behalf of the Australian Aged Care Industry Information Technology. I welcome you to the My Health Record Guidelines in Residential Aged Care. This is an education and awareness session, so thank you for joining us all today. Before we start, I'd like to acknowledge the traditional owners in which we're presenting from. I think our presenters are all around the countryside as our participants. So welcome on board. I'm presenting today from the Southern Moreton Bay area, and I acknowledge the traditional owners and their custodian of the lands on which we meet. On behalf of the council, we pay our respects to their ancestors and descendants who continue their cultural and spiritual connections to country. We recognise also their valuable contribution to Australian and global society. So in preparation today's webinar, I would like to go over a few housekeeping items. As you would be aware, all microphones have been muted for the purposes of recording. But if you have any questions during the meeting, please post them in the Q&A panel. The session is being recorded and will be available on the council's website in the coming days. If you have any technical issues during the meeting, please again use the Q&A panel. And welcome on board, everyone. I see more people have joined us. Today's presentation will focus on My Health Record Guidelines for Residential Aged Care. We are joined by personnel from the Australian Digital Health Agency to provide an overview of the importance of My Health Record Guidelines. And I welcome on board today Julie Curry and Peter Thornton. Thank you for joining us today. I'm going to lead through some of the work that the council has been undertaking. But firstly, I'd like to invite Peter and Julie to come on board and present the information on supporting the implementation of My Health Record in residential aged care. Welcome on board.
Thank you, Anne, and good morning, everyone. So for some people, this might be quite familiar in terms of what the aged care program is delivering, and just another acknowledgement here. The Australian Digital Health Agency acknowledges the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures, and to elders past, present and emerging. So both Peter and I will tag team a little bit through this morning's update. I will just provide an overview of the aged care program, and more specifically the projects that we kind of have underway to support a couple of the recommendations of the Royal Commission, primarily 66 and 68, so around transitions of care and universal adoption of My Health Record. And then Peter will talk specifically to his project and the support to connect and register facilities to My Health Record. So the whole objective of the program is to enable older Australians to receive better connected aged care and healthcare, primarily through the use of My Health Record, and of course through enabling a digitally proficient workforce and healthcare sector. So we've been kind of in the progress now for almost a couple of years. We've got one more year to go. Our program is due to end in June 2024. And we have 4 key projects underneath the program. The first one is My Health Record registration, which Peter will talk to shortly. The next one is around industry enablement and working with vendors to enhance their functionality to register and connect to My Health Record. So we have a current industry offer underway in progress with 13 software vendors. We now have 4 vendors conformant to My Health Record, so they've gone through the process with us to make their product conformant to My Health Record, and working with the others to get them over the line, hopefully in the next weeks or so. We are due to release another industry offer around July, primarily to support the aged care transfer summary. And the Aged Care Transfer Summary is another project of the program aimed at creating a brand new clinical document to be uploaded to My Health Record by residential aged care facilities to support the transition of care of a resident from a residential aged care facility to an acute care setting. So that's one of the key kind of recommendations of the Royal Commission and our response to that. The ACTS is kind of going through its internal build process at the agency at the moment, and we hope to have that ready by around October this year, which means it kind of ties in with the timings of the second industry offer, because it's about working with vendors to enhance their functionality to support the upload of the ACTS. And we also have a project to define kind of quality statements or standards around clinical information systems used in residential aged care. So that's in a consultation phase, or about to enter a consultation phase at the moment. So that's just kind of a general overview of where we're at and how we're progressing. And I'll pass to Peter to talk more specifically about his project.
Thanks, Julie. So as you can see on the screen, we have a project called the My Health Record Registration Project. We're a project dedicated to offering registration support to residential aged care providers around the country. So we're doing a messaging campaign. We're promoting the benefits of My Health Record. We're promoting our offer of registration support, and we're doing that in a state-by-state approach, beginning with Victoria at the start of this year. We're currently in New South Wales, and we've got Queensland next up early in July. So a little bit about what the registration support involves. We're offering one-on-one sessions with residential aged care providers, and we're dedicating a registration support officer. This resource is experienced and knowledgeable about the registration process. They can take organisations of any shape or size or type and guide them from beginning to end in the registration process.
Just to continue on what he was saying, the team is on hand to provide support to residential aged care facilities of any shape, size, form, to step them through the actual registration process, which ties into the guidelines that ACIITC have released. So there is proactive meetings, I guess, that the team facilitate that take the providers through each step. They work through things like setting up the security and access policy, the RO, the OMO, all of the required roles. And then at the end of the registration process, there is a process that we've got to transition residential aged care facilities or provide additional support to embed the use of My Health Record through education and training within our agency team. So that email address there at the bottom is really there for anyone to contact us, and the team will be on hand to provide the registration support.
Thank you, Julie, and thanks, Peter, for that overview. So it's my role now to take you through the guidelines and why we as the Aged Care Industry Technology Council think it's very important that these guidelines be used and utilised. I know many on the screen today are aware of the work that the Australian Aged Care Industry Technology Council does. We were established in early 2000s, formalised in 2007, and really our role is very focused on harnessing the role that innovation and technology can play out for a high quality aged care sector, but also we're really interested in what the evidence is telling us. All of our work is backed by analysis and evidence, and we're very focused on improving the outcomes for older people and their families. So let's go. What is the challenge? We know that for a variety of reasons, including resource shortages that have impacted on the sector, and the lack of conformance software, the take-up of My Health Record in the sector has been very slow. But it's great to see that this is improving, and as Peter and Julie indicated, that's really I think, as a result of the work that the Australian Digital Health Agency is doing in every state and territory. And it now sits at 23% of uptake of residential aged care facilities being registered for My Health Record. So in great improvement. Just in terms of a bit of background to the development of these guidelines, the Council did partner with the Australian Digital Health Agency to deliver this guideline specifically for residential aged care facilities, and we hope to be able to publish something specifically for community care in the future. But we did this in partnership, and I would like to thank those partners, which included the Digital Health Professionals Association of Australia, Leading Age Services, Aged and Community Services Australia, and of course we all know now both those agencies are combined and represent the Aged and Community Care Providers Association. And I'd also like to note the contribution of the Australian Nursing and Midwifery Foundation. These guidelines were launched on the 23rd of May and are available at our website. I'd like to bring to your attention that the importance of the guidelines. The Council sees these guidelines as a really important tool to promote continuity of resident care and to improve health outcomes. This newly released document provides information and guidance for residential care facilities on the appropriate use of My Health Record. I hope that you'll find that they're very user-friendly, and I'd like to call out for those providers who helped us in the co-design of these guidelines and inputted into the structural arrangements. This is really targeted at allowing aged care providers to view and upload resident health information that is relevant to their care, such as an event summary, for example. These can also be viewed by other health professionals involved in the care of older people, and I'll talk a little bit about that later. And we see that there is a significant potential to improve the care coordination and health outcomes for older Australians receiving aged care. Now, I'm just going to go into the guidelines in a bit of detail to allow you to understand what's in the guidelines and how to use them. In doing the work, we realised that there is a wide variety of potential users for the guideline within residential aged care settings. For example, what a senior management personnel is going to be interested may be very different from the implementation team or the administration team. And we've done extensive work to accommodate the different groups in the guideline, and they're organised in logical sections, which I hope makes it easy to find the information relevant to your role. There's a table at the front of the guidelines, and that will help you to point out the relevant section that you might be interested in. Your governance team may have special interest in the policy and compliance section, while the medical professionals in your facility may be more interested in the day-to-day use of My Health Record. The outline on your screen is the table of contents of the guidelines, and I will briefly go through these chapters with you. Firstly, what about My Health Record? The guidelines detail that My Health Record is a secure online summary of a person's health information, that the system is available around the country any time of the day. It's personally controlled, and an individual controls what is allowed to be updated and how it's accessed. The system is protected by both legislation and extensive cyber security protections. So the next chapter looks at why to use My Health Record. And there's a range of compelling reasons. All of these are listed on your screen now. I bring your attention to a series of Royal Commission recommendations that relate to My Health Record, including recommendation 56, that a new primary care model to improve access, where the use of My Health Record would be an accreditation criteria. Recommendation 63, which spoke to access to specialised telehealth services. Recommendation 66, which pinpointed improving the transition between residential care and hospital care. Recommendation 68, the universal adoption by the aged care sector of digital technology and My Health Record. And recommendation 109, which spoke to the use of ITC architecture and investment in technology and infrastructure in the sector. My Health Record also can support residential aged care facilities with aged care quality standards and accreditation, namely Standard 1, Consumer Dignity and Choice, Standard 2, Ongoing Assessment and Planning with Consumers, and Standard 3, the Personal Care and Clinical Care as a source of information. We see that My Health Record can also provide significant value. If you have conformance software, you will be able to upload your residents' health information, which then can be viewed by other health professionals involved in their care, in hospitals, GP practices, and other primary healthcare services in the community. So there's an extensive range of health information available within My Health Record framework. Of particular relevance to residential aged care facilities is medication management, hospital discharge summaries, advanced care planning documentation, and much more. Some of those are on your screen now. In terms of policy and compliance, requirements are outlined in this section of the guidelines, and they're really targeted at teams responsible for policy, compliance, risk, governance, and quality assurance. The core component for meeting compliance requirements is having a security and access policy, and an example is provided in the guidelines. So hopefully the guidelines do a lot of primary work for facilities. This policy also covers a range of items, including how you authorise, track, and train users, and what physical and software security measures are in place. The guideline covers workflow and practices, compliance management, and training requirements. We also have a section on privacy and security, and this guideline is targeted at everyone who uses My Health Record. The security of My Health Record is dependent on a number of components, including resident control, security access policies, and software controls. And this is fully detailed in this section. Breaching security requirements is a serious issue with penalties, and the guideline advises what steps are necessary to prevent any serious issues arising. So connecting to My Health Record, this section is of the guideline is targeted at the technical users who are responsible for the connection to My Health Record. That's probably mostly information technology and administration roles within your organisation. It also focuses on the processes required by aged care facilities to connect to My Health Record. So we also cover the steps to connect to My Health Record, and the guidelines will step you through the process of accessing My Health Record, either through the provider portal or through your own software, if that software is, of course, conformant. We detail the using of My Health Record, and this targeted at users approved to view or upload My Health Records. It will help you understand how authorised users can view, edit or delete documents through the available channels. We also look at how you can support residents. This section is targeted at staff responsible for instructing and supporting residents in the use of My Health Record. Residential care facilities can choose to assist their residents to register and access My Health Record. This section also covers the circumstances in which emergency access can be provided and the differences between a resident's nominated and authorised representatives. Our next section talks to external healthcare professionals. External healthcare professionals who provide services to your aged care residents. And this section details how these professionals registered for access to My Health Record can use this within the residential care facilities to view or update records. Our next section of this presentation, I'm going to hand over to my colleague, Georgie Gould. Welcome on board, Georgie. Thank you for your role in putting today's presentation together. Georgie's going to lead you through how to access the guidelines and where to get support when you need help. Thanks, Georgie.
Thank you, Anne. I will provide an overview of how to access the guidelines and the support that is available. My Health Record guidelines are now available on the Aged Care Industry Information Technology Council. I'll give everyone online a moment to scan the QR code on the screen to download the My Health Record guidelines for residential aged care if you haven't done so already. If the QR code is not working for you, please visit the Council's website at www.aciitc.com.au. When you follow the links to download the guidelines, you will be asked to complete a short survey as the Council tracks all downloads to provide feedback to the Australian Digital Health Agency. As of this morning, we have had over 200 downloads of the guidelines since launching last week. The Council encourages all residential aged care providers to download the guidelines, as the document provides information and guidance for facilities on the appropriate use of My Health Record. To gain support in registering, connecting, or using My Health Record, we recommend contacting the Australian Digital Health Agency on the email listed on your screen. If you have any issues accessing the document, the Aged Care IT Council's website, or have any comments in the document, please email secretariat@aciitc.com.au. Thank you for your time today and supporting this important work.
Thanks, Georgie. Now it's our important time to go through questions from the participants today. Please take the time to post the questions, any of your questions in the Q&A panel. Welcome also on board, Julie. Thank you for being willing to take some Q&As from participants today. I'll start with the first two that are posted, and I have a number of other ones that have come through directly. But before I start, encourage you that are involved in today's session to post your question. So the first question is regarding support, Peter and Julie. What sort of support is available for providers who are using software that is non-conformant with My Health Record?
Certainly happy to take that question. So we offer registration support regardless of what type of software that you use. We can connect you and your organisation with the National Provider Portal that allows you to view My Health Records of your residents. So that's certainly one way we can tailor our support. So we have support material of all different kinds, and we collect it and pull it together to suit your organisation type and the software that you use. And yeah, we're happy to be, we mould our support direct to your digital maturity and whatever software that you use. So there's no software that we can't support you with.
Thank you, Peter. Julie, did you want to add anything to that response?
Look, ideally, you do want to actually use conformance software. It is much better, but in the absence of that, yes, that we can access and support you through the National Provider Portal.
Thanks, Julie. And we're working with the vendor community to also promote the importance of signing up to become conformant and doing the work required to make sure that the software is conformant. So there is another question around conformance in software. The question is around the 13 vendors that you're already working with. Where does someone get information about those? I might hand that one to you, Julie.
Yes, thanks, Anne. So we're happy to share the list with Georgie and Anne to kind of post out more broadly later. But the 13 vendors we are currently working with are a combination of clinical information system software vendors and medication management software vendors. And they are Compact, Health Metrics, Humanitics, LeeCare, Manad Trust, Medimap, Modius, Person-Centered Software, Telstra Health, and Unleashed Technology. So again, happy to share those that list more broadly. And the ones who are currently conformant, who have actually achieved conformance through our industry offer, are ACIITC. ACIITC. I missed that one. Oh, sorry, off the list. Best Practice, Manad Trust, and MPS Connect.
Thanks, Julie. And look, I've got a couple of other questions that relate to conformancy. Are there any incentives available for vendors to become conformant?
Well, I guess that's the industry offer. That's the purpose of the industry offer. So there is a financial incentive associated with participating. And obviously the current one is well and truly in train, which is why we're offering another industry offer to really kind of support the implementation of the ACTS.
Thanks, Julie. I've got a question here about when will these guidelines be adapted for community care clients?
At the moment, the scope of our program is very much on residential aged care facilities. That's not to say community care is not being considered, but at the moment, the program is being funded to specifically respond to residential aged care facilities.
Thank you, Julie. I've got a question about the specific links here. Does this link to the government provider management system, or sorry, how does My Health Record link to the government's provider management system that the team in Department of Health and Ageing under Favour Virus are working on?
Yes.
Julie, over to you.
I'm probably not too au fait with what is being developed over at the department side, only to say that they are still separate. So the GP management, the GP, whatever's being developed over at the department side is separate to what we are doing to support registration and enhancement of software for vendors. Separate things.
Right, thank you, Julie. How does the Australian Digital Health Agency anticipate that residential aged care facilities will manage a resident cohort where more than half cannot consent to My Health Record due to dementia?
We offer, obviously our project is dedicated to registration support, the provider level. So we connect providers to My Health Record. But as part of that registration process, we do cover things like consent, security and access policies, things like that. But of interest to everybody would be that we do as an agency offer education and training, and we do cover topics like consent in more detail. that is post-registration education. So yeah, consent is certainly a big topic that comes up quite often for us. And yeah, we have material and webinars and training, and we cover that space quite comprehensively because it is a conversation that needs to happen. And certainly notifying residents, families and carers and visiting clinicians about a provider that has now adopted My Health Record. We've developed some templates and some letters that can be used by these providers to communicate these changes with their key stakeholders. And that commences the conversation, and consent can be handled in that conversation. And we do try and prepare providers for these conversations. And yeah, that's certainly something that we really try and focus on. We do want My Health Record used and used appropriately, and all of our guides and support material has that in mind.
Thanks, Peter. I've got one directly here, Julie and Peter, from a residential care provider who's a small provider and a daily struggle, like most providers, I guess, in ensuring security of their data and protection of their data. Is there any direct support for residential aged care facilities with their cybersecurity and protection in respect to My Health Record?
I guess a level of assurance I can provide is if your vendor has actually gone through the agency's My Health Record conformance process, part of that is meeting certain criteria around cybersecurity and data security. So that's also, I guess, part of the other project around the development of standards, again, to kind of look at that defining requirements at a more holistic level. So while there are elements of that, the project around standards will hopefully look more broadly from a holistic sense to be able to actually provide guidance to the sector then around what you should look at when you're trying to assess a system or a vendor or et cetera, et cetera. I'm sure the agency would be able to answer any questions you may have around cybersecurity or data security more broadly. So yes, I'm happy to take them and direct them to the right area of their agency if there are some more specific questions.
And I think, Julie, it's fair to say that the guideline does touch on these issues and provides some best practice ways to address that. So thank you, yes, Julie. We do have a question, I think, from a vendor. If you're a vendor, how do you register to become conformant? I'll read it. Do you have to register via the project if your vendor is still willing to upload to My Health Record?
No, you don't. So you don't have to wait for an industry offer, or if you haven't been successful in participating or even in applying for one. No, there is a separate process that the agency runs to support anyone really who would like to progress to achieving My Health Record conformance, regardless of an industry offer. So we can accommodate that as well.
Fantastic. And Julie and Peter, we've had some requests in the background here for the recording of this session, and it will be freely available on the aged care industry's website, and we'll be certainly making it available to anyone who is interested in it in the coming days. One more question: what funding support, if any, is available to residential aged care facilities to achieve My Health Record conformance?
So firstly, I guess My Health Record conformance is not something that the facility has to worry about. That's really the software. So it's the system that you're using to manage the care of your residents. So unfortunately, because of that, there's no financial incentives for facilities. It is the current industry offer that we have is to support the systems to be able to achieve My Health Record conformance.
Another question just through, could the guidelines be expanded to provide advice on how facilities balance two systems running concurrently to ensure both records are up to date, particularly if their software is not conformant? I guess, Julie and Peter, this really raises, you know, the diverse range of platforms and software that are being used in residential care facilities. I draw your attention to the, I think it was 280 plus that we found in our recent work funded by the agency in respect to just clinical care systems. So it's a very contemporary issue for many providers. Any comments?
No, but I guess we'd be happy to hear views. If you think that there is gaps, I guess, or something that we may be able to support the sector with, we'd be happy to hear it. There may be specific education webinars we might be able to create if there is a gap or additional information required, but happy to hear more.
And the councillors would welcome that questioner to make contact. We're certainly through our national roundtables collecting information to feed back to the Australian Digital Health Agency. But we're also very keen to, after a short period of time, evaluate the guidelines and provide feedback to the agency on how we're seeing it being used, what can be improved, what the gaps are from this original guideline. So we encourage your feedback and we would encourage your involvement in our national roundtables. A couple more questions. If a facility doesn't use conformance software, they may have to change vendors, is the comment. How likely is this? I guess it's early days, but Julie and Peter, I guess from the council's point of view, we're seeing providers already making procurement choices in respect to that list of conformance software. And we would be encouraging people, if they're on a procurement round, to actually be knowledgeable and download those lists of conformance software. It will make the uptake improve, but I think it would streamline some of the processes being used. Julie and Peter, any comments?
Just further to that, and yes, it is a business decision, I guess, a facility's business decision about, you know, their software. Ideally, you want your software to be conformant to My Health Record if you want to be able to view and upload information to it. It's not mandated, you know, it's not a mandatory requirement. It's something that we're working towards to support the sector to adopt it more universally, but it's not a mandate.
But I guess we're all doing our bit, aren't we, to yes. Encourage vendors to consider conformancy and to do the necessary developments. And I guess that's pretty much in line with the next question on the list here. What happens if vendors don't want to integrate with other vendors? I guess it's procurement choices, isn't it? So we're highly recommending that you look at conformance software and encourage providers themselves have ability to encourage vendors to improve their systems. And we know that many user groups are actively involving non-conformant software to improve. So this, I think, Julie, leads on from your comment about that it's not mandated as yet or currently. If it's not a mandate, the questioner asks, why is My Health Record mentioned specifically in the draft of the revised quality standards? I'm not quite sure whether you can answer that.
I can only kind of say from a governmental kind of perspective now, I guess, the Minister of Health, in his speech, and I guess where the budget has kind of been handed down, it's been made more clear that digital health is important, therefore my health record is important. So I guess that's the reason why it's not a move to mandate, even though I guess there will be a requirement around pathology and diagnostic imaging, more so, but not yet any mandates around residential aged care facility use of my health record, but highly encouraged.
Thanks, Julie. Peter, did you want to make any further comments in respect to that? I guess the council itself is very keen to promote best practice, and we are actively collecting case studies of where my health record has really improved and been impactful for the quality of older people.
That's quite right. A lot of what my project team do is promote the benefits of digital technology and my health record in residential aged care. And that is a key educational piece. It's to promote what we do. We are a key enabler of many of the things that the agency is looking to deliver in aged care. So yeah, we do focus a lot of our messaging on the benefits of my health record, because there are significant benefits of my health record for the residents, and certainly with respect to transitions of care between facilities and hospital and back again.
Well, that brings us to the conclusion of our question time. I'd like to take the opportunity to thank Peter and Julie for their time today. We know as the council how collaboratively that the agency is working with entities like our own, and how focused they are in supporting residential aged care facilities to implement my health record in their daily operation. So I'd like to thank Peter and Julie for their time today, and also to thank Georgie Gould, who has also presented today. If you've got any further questions, we'd love to hear from you, and the council's both our web address and our email address are available on the screen now. As I said earlier, this presentation has been recorded and will be available for distribution in the coming days. Thank you everyone for attending today. Look forward to your active engagement in my health record. Thanks everyone.